Good day, this is Charles Axel Hesta from BSN 11I. In this video, I will be performing a demonstration on assessing the abdomen. So, assessment of the abdomen consists of inspection, auscultation, percussion, and palpation. So, prior to the conduct of the procedure, first thing to do is review client's previous medical record if it is available. So next is prepare the necessary equipments needed to conserve time and energy. So the equipment that I am going to use includes a tape measure, a stethoscope, and a ruler. This one. Okay. So, and now perform hand hygiene to protect the patient and me as well for the infection and the cross-contamination. Okay, good day, ma'am. I am Charles Hasta from your student nurse for today. May I see your wristband, ma'am? And can you please state your complete name and your birthday, please? Okay, thank you. So, how would you like to call you today, ma'am? Okay, thank you, ma'am. So, today I will be assessing your abdomen. So, which means I have to expose your abdomen. So, listen to your bowel sounds and also feel for your internal organs. Would that be okay, ma'am? Okay, now I am going to close the door and close the curtains for your privacy while performing the assessment. So, now ma'am, before we start, I encourage you to void first so that you would be more comfortable during our assessment, okay? Okay, so ensure that the patient has emptied bladder. So prior to the conduct of the procedure, because a full bladder can make the patients uncomfortable and it can reduce accuracy of the fundal height measurement. So, first, position the client in a supine position and place pillow underneath the patient's knees. So this position ensures the abdomen muscle relaxation to avoid putting additional pressure on the patient's abdomen. Okay, so now cover the upper part and the lower part of with a bed sheet, leaving the abdomen exposed. Okay, ma'am, can I expose your abdomen for the assessment? Okay, thank you. So now observe the abdominal skin. So note for any vascularities. Note for any striae or stretch marks. So check if there are any scar, lesions, and rashes, and note for the history of scars and document its location by quadrant reference lines. So okay. So, and also check the umbilical color, contour, and its location. Okay. So now, inspecting contour while the client lies flat supine or bed, sit beside the client, look across the abdomen at a level slightly higher than the client's abdomen. Okay. Okay, and stand at the foot of the bed and observe the abdominal symmetry. Okay, thank you. So, measure the abdominal girth using a measuring tape around the patient's abdomen at the level of umbilicus. Okay, ma'am, can you sit position? And just like that now. Your head upper. Okay, I'm going to make sure you note the number and mark the umbilicus. So after that is proceeding now for the auscultation of the vowel. Okay, ma'am. So can you lay down first? Okay, so proceeding now for the auscultation of the vowel sound. So use the diaphragm of the stethoscope and make sure that it is warm before placing the abdomen, and apply light pressure or simple rest at the stethoscope if the abdomen is tender or painful. So perform the auscultation with the right lower quadrant, then counterclockwise. So listen each quadrant for 5 minutes, minimum 1 minute per quadrant, to confirm any absence of vowel sound. So note the intensity, pitch, and frequency of the sound. Okay. Okay. So now auscultate for vascular sound. So to listen for the vascular sound, use the bell of the stethoscope. Listen for bruits and over the abdominal aorta, renal, iliac, and femoral arteries. Sorry. Okay. Okay, now I am going to use the bell. Okay. So now auscultate for a friction rub over the liver and spleen. So to listen for the friction rub, use the diaphragm stethoscope to listen for the friction rub over the liver and the spleen. So I'm going to use the diaphragm. Okay. So now I am going to proceed to by percussing. So by percussing of the patient abdomen with the percussion hand technique, lightly and symmetrically percuss all quadrants. So percussion may proceed clockwise or up and down over the abdomen. Next is percuss the span in the mid-clavicular line. So from the right lower quadrant along the mid-clavicular line, percuss upward towards the liver and note for the change from the tympani, dullness, and mark its point. Okay, so now percuss in the right midclavicular line on the area of long resonance around the third intercostal space, and percuss downward to the liver and note for note for the liver dullness and mark its point. Okay, so now for the vertical liver span at the mid sternal line, starting just above the umbilicus percuss upwards towards the liver, and note the change from the tympani dullness and marks its point. Okay, so now measure the distance between the 2 points. Okay, now. Okay. So next is to assess for the liver descent. Ask the patient to take a deep breath and hold it while percussing the right lower quadrant. So towards the liver, and note for tympani dullness and mark it this point. So okay, ma'am, can you take a deep breath? Okay. Okay. So now I am going to measure it by using the measuring tape or ruler, perhaps. Okay. So next is percuss the spleen. So begin percussion in the posterior to the left mid axillary line, or MAL, and percuss downward. So note for the change from the lung resonance to the splenic dullness. So perform it method of percussion to determine enlargement by asking the patient to take a deep breath and start percussing, and on the last left interspace at the anterior axillary line. Okay, ma'am, can you lay side position? Okay. Okay, so next is perform the liver blunt percussion to assess the liver tenderness. So place the lower right hand against the lower anterior rib cage, and then use the ulnar surface of the left hand to strike the right hand. Okay, ma'am. So I'm going to. Ma'am, do you feel any pain? How about this one, ma'am? Thank you. So next is to perform the kidney punch to assess kidney tenderness. Reposition the patient in a sitting position, and place the left hand to costal vertebral angle over the 12th rib. Okay, so use the ulnar side of the right fist to strike, and left hand and ask for any pain. Okay, ma'am, can you sit? Okay. Okay, ma'am, do you feel any pain? Okay, thank you. Can you lay down again, ma'am? Okay, thank you. So, next is to test for ascites and test for the shifting dullness. So while the patient is lying in supine on the bed, percuss the flanks of the patient from the towards umbilicus, and noting the change from dullness to tympani, and mark its point. Okay, ma'am. Going to. Okay. So now, so next is reposition the patient to the side lying position, and percuss the abdomen from the bed upward, and noting for the change from the dullness to tympani. Okay, ma'am, can you roll over it aside again? Okay. So now for the fluid wave test, position the patient in a supine position. Ask the patient to press the edges of his hand firmly down to the midline of his abdomen. Okay, ma'am, can you back to your position? And can I ask this one? Yes. And okay, use the other hand at the top of the opposite side of the abdominal wall. Note for the fluid movement. So I'm going to use my both hands. Okay. Okay, ma'am, can you take a deep breath? Exhale. Okay, thank you. So now for the palpation of the for the light palpation to assess for the tenderness and presence of mass. With the client lying relaxed in a supine position, begin with a light systematic palpation of all 4 quadrants or 9 regions using the finger pads. So initially avoiding any areas that the patient had identified as painful. Okay, ma'am, I am going to palpate. Okay, so next is to perform the palpation, which is done to feel the internal organ and masses. So compress the abdomen to a maximum of 5 to 6 centimeters using the palmar surface of the hand, and initially avoiding the painful areas to palpate for muscle resistance or masses. Okay, so now perform the next procedure is perform the moderate palpation at the umbilical ring. So noting for any presence of masses, swelling, nodules, and granulations to assess for tenderness and presence of mass. Okay. So next is the palpation of the abdominal aorta. So use both hands, deeply palpate the epigastrium slightly to the left midline. So, okay. Okay, so now for the palpation of liver, assess for the liver contour surface, presence of the nodules, tenderness, and irregularity. So place the left hand under the client's back at the level of the 11th and 12th ribs, while the right hand is laid parallel to the right costal margin with fingertips pointing towards the client's hand. Okay, ma'am, I am going to put my hands. Okay. Okay, ma'am, can you take a deep breath? Okay, another one, please. Okay, thank you. So now, perform the hooking technique. So stand at the patient's right side by facing his feet. So press in the upward costal margin with your fingertips and ask the patient to take a deep breath for the procedure. Okay, ma'am, can you take a deep breath? Another one now. Okay, thank you. So now, because the spleen and assess for the splenomegalis. So stand at the right side of the patient and reach over the patient's abdomen. So which with the left hand under the posterior lower ribs and pull up gently and place the left costal margin and press in towards the spleen and ask the patient to take a deep breath and press inwards and upward. Okay, ma'am. You take a deep breath, ma'am. Okay, another one, please. Okay, thank you. So next is repeat the procedure with the clients lying at the right side with the legs somewhat flexed at the hips and knees as needed. So, okay ma'am, can you roll at the right side? Okay, so take a deep breath ma'am. Okay, another one. Okay, thank you. So next is palpate the kidneys to assess for the kidney enlargement. So stand at the patient's side. So place the left hand under the patient's right posterior flank at the right hand at the right costal margin at the mid-clavicular line. So instruct the patient to take a deep breath and compress the fingers during the inspiration. And ask the patient to exhale and hold her breath briefly and gradually release the pressure of the right hand to feel the right kidney slipping beneath the fingers. Okay, so ma'am, I am going to perform the procedures. Okay, take a deep breath, ma'am. Another one. Thank you. So now, palpate the left kidney with the procedure reversed. So state the urinary bladder, begin palpating at the synthesis pubis and move upward and downward. So this is to estimate the bladder borders. Okay. Inhale, exhale, inhale. Okay, thank you. So next is for the appendicitis or the peritoneal irritation. So palpate deeply at 90 degrees into the abdomen away from the painful or tender area. So then suddenly release the pressure and listen and watch the patient's expression of pain. So after that, ask the patients which hurt more in pressing or in releasing. Okay, take a deep breath. Take a deep breath. Another one, ma'am. Okay, so which hurt the most, ma'am? The in releasing or when I press it? Okay, thank you. So now for the referred rebound tenderness or the robusing side, palpate deeply in the left lower quadrant and quickly release the pressure. Okay. And here, ma'am. Okay, inhale. One. Okay, thank you. So, ma'am, did you feel any pain when I released or pressed in it? Okay, thank you. So, next is for the SOA sign. Reposition the patient in the right side lying position and then hyperextend the right leg. Okay, I am going to expose now your leg, ma'am. And can you roll in the right side? Okay. Okay, thank you. You can go back to your position, ma'am. So next is to the obturatory sign. So first is support the patient's knee and ankle and flex the hip and leg and rotate the leg internally and externally. So okay now ma'am, I am going to expose your feet again, or legs. Okay, I'm going to support your knee and your ankle. Okay, thank you. So the next procedure is the hypersensitivity test. So using a sharp object, stroke the patient's abdomen. Do this several times and note for any complaints or pain. So for this procedure, I am going to use a ruler. Okay, ma'am, I am going to expose now your abdomen. Okay, ma'am, do you feel any pain? Okay, thank you. So next procedure is to test for the cholecyst sign or the cholecystitis. So press your fingertips at the right costal margin and ask the patient to inhale deeply and note for any increase in pain felt. So, ma'am, can you inhale deeply? Okay, inhale. Okay. Okay, ma'am, we are done in our assessment, and I will be back for your summary of the procedures that we perform. Okay. So okay now, ma'am. So we are done in assessment of your abdomen. So here's the summary of what we have done. So upon the inspection of your skin is uniform colored. So no rashes, no lesions, no scars. So and your umbilicus or your navel in the midline and inverted, which is normal. So your abdomen is symmetrical, and upon the auscultation of your bowel sound, uh, while I was listening into it, the sound are pretty normal, and I hear no bruises or venous hump. So while I was measuring for your liver size, your liver span is at the mid clavicular line. So I'm here. I measured it at 7 centimeters, and while I was measuring flow at the liver span in the mid sternal line, it is measured at the 5 centimeters, which is above normal. So upon the percussion and the palpation, there were no tenderness, no masses, and no bulges and no swelling. So overall, your abdomen is doing good. Okay. So do you have any questions or clarifications before we end, ma'am? Okay, so overall, your abdomen is doing fine. So, but before I leave, I just gonna have you some on advice on how your internal organs healthy. So, first is to eat healthy foods as much as possible. So, avoid drinking too much alcohol or hard liquor because it may cause damage to your liver. And instead, drinking alcohol might as well increase your fluid intake, such as water, to flush out unwanted residues in your liver and your bladder and intestine. Okay, and if you have any urge to pee, do not delay it because holding back your pee might cause bacterial to multiply, can cause serious disease such as UTI. So that's all for today, ma'am. Do you have any questions? So okay, please, I have if you have a sudden question, so don't hesitate to call me. So thank you for the cooperation, ma'am, and have a great day. And after that, perform hand hygiene before we end.